Started, huh?
Okay.
Started.
Okay. Second page, ma'am. Third page, ma'am.
No.
2 pages only.
Yeah.
Shall I start?
20 seconds are remaining.
Okay.
Hmm? Started your 10 minutes time.
Okay. Hello. I'm Dr. Bhumika. I'm the doctor in the gynae clinic. Am I addressing Mrs. Peta Smith?
Yes, doctor. I'm Mrs. Peta.
May I confirm your age, please?
I'm 33-year-old.
And how would you like to address?
Peta is fine, doctor.
Thank you. So, Peta, I see that you have been called for a follow-up for a report for a procedure that you underwent around some time back. Is that fine? Is that correct?
Yeah.
Um, so, I'll be discussing your report. Before that, is it okay if I ask you a few questions?
Yeah.
Do you have any other concerns or expectations from today's consultation?
I'm a little bit anxious because I don't know. I was about to see the GP, but then the hospital called me up, so I'm a little bit worried whether there is anything serious.
I understand that you are anxious, but yes, we'll be discussing your reports in some time. Is that okay?
Yeah.
Um, Peter, can I know what complaints did you have before undergoing the procedure of suction, before undergoing the surgery of suction, curettage?
Yeah, doctor. Actually, we were planning a pregnancy, me
Hmm.
and my boyfriend. I got pregnant, but at around 8 weeks, I started having spotting. And when a scan was done, it has shown that the baby's heartbeat was not there. It was very
Okay.
upsetting time for both of us. And since tablets didn't work, they advised me to undergo a surgical procedure. And I went,
Okay.
I had done it 8 weeks back. They sent some blood investigations and some tissue testing, and then they
Okay.
discharged me, telling me that I will be called up. I need to follow up with the GP, and
Okay.
things will be normal. But I don't know
I
why they
understand.
called me.
Yes. Yeah, I understand that you are quite anxious and you have been through a very difficult situation. How have you been and your partner coping up with this?
We both of means we are taking a time, but yeah, we are healing.
Okay. Any other complaints? Do you have any problems in the waterworks or bowel?
No,
Uh, any tummy ache? Any bleeding at present?
no.
Okay. And is this your first pregnancy?
Yeah, doctor, this is my first pregnancy, and we are really looking forward to have baby. And
Yes.
that is another concern. When can I start? planning for my
Yes,
next baby.
we'll be I'll be clearing all of your concerns when we discuss the reports. Apart from that, are you generally fit and well? Do you have any medical illness for which you're following up with GP?
Uh, no, I do not have any other concern. I'm quite fit and well.
Okay, okay. Uh, how were your periods? Were they regular?
Yeah, my periods were regular.
And have you used any contraception before?
Actually, I'm not planning to have. Now I'm planning to have baby, so I'm not using. Yeah, previously I used.
Okay, and any surgeries on it except this one? Any other surgeries on your tummy or down below?
No.
Any family history of concern?
No, doctor. What kind of family history you are interested?
Um,
Hmm?
uh, family history of clots?
No.
Uh, and may I ask you some personal questions?
Yeah.
Do you smoke?
No.
Okay, and take any alcohol?
Occasionally in the parties, but not regularly.
And what do you do for your living, Beta?
Actually, I go to a law firm where I work at a office desk job.
Okay, and who do you live with?
I stay with my boyfriend.
Partner. Okay. Uh, Thank you for sharing your information, Beta. Um, do you want someone to be around you while we discuss the report? Because I'm going to share a
No,
lot of information with you. So,
no, no, no.
okay. Beta, I have confirm your name and NHS number, and this report belongs to you. Um, I'm afraid that I have some concerning news for you. Uh, the report that has we have done it shows that it is a molar pregnancy. Now, have you ever heard about it before?
No, doctor, what it is?
So, Beta, so when a baby is formed, normally we have the baby has two sets of chromosomes. One set of chromosome comes from each parent, one from the sperm and one from the ovum. But a molar pregnancy is a pregnancy which is abnormal from the start. So there is an imbalance in the genetic material, the imbalance in the chromosomes which form that. So in that there are two types. There is a partial and a complete. In the complete form, there is like imbalance in the genetic material which is from the father. So um, it, this is a condition which is called as a molar pregnancy. Are you getting me?
Okay. Is there any particular reason of having this molar pregnancy, doctor?
Uh, there's no particular reason, but it is found like in one in every 700 pregnancies. It can happen randomly. Sometimes it can be because of in the extremes of the age. Otherwise, uh, it is a rare condition, and but does have some implications on the pregnancy and on the future pregnancies. Can I discuss that or?
Yeah, go ahead.
So this pregnancy, because of this abnormal pregnancy, there is possibility that some of the abnormal pregnancy cells might still be inside the womb and might start growing. So for that, we need to monitor the pregnancy hormone called beta HCG. Okay. Now this hormone,
Okay.
if so, we need to monitor your hormone levels every weekly till the levels come normal, and we need to continue that for at least 6 months from the date of the evacuation, or maybe longer if the pregnancy hormones take a longer time to slow fall down. Okay,
Okay. Okay.
and we need
Why
to
so, doctor? Is there anything to worry about?
um, uh, uh, this is a completely curable condition, and if at all the pregnancy the hormone levels are staying high or they are rising, then it means that some of the abnormal cells they are still inside the womb, and in that case um, it might be raising a suspicion of cancer like condition. I don't want to scare you, but this is a completely curable condition with almost excellent cure rates, almost 100%. So we do register all the patients at a specialist center, that is the GTD centers, which are there in Dundee and London and Sheffield. And we do need a regular follow up. Are you getting me?
Oh, yeah, quite clear, doctor. Then when can I plan my next pregnancy, doctor? Because I'm really worried about that, as my age is also
Yes.
ticking.
Um, so after the pregnancy levels, after the beta hormone, the pregnancy hormone gets normal. After that, we need to monitor you for a minimum of 6 months. So total of 6 months from the time of the evacuation, and if it takes longer time to slow down to come down to normal, then a little longer. But once the follow up is complete, then you will be ready to you can ready to plan. You might plan at that time. But if at all the pregnancy levels, the beta hCG levels don't fall down, then in that situation we might need to offer you some injections, and I'm afraid that in those situations we might have to delay, ask you to use some contraception um, for at least a year. uh, During that time you will be advised not to get pregnant. uh, are you getting me?
Is there
So
anything which will
this is
affect? Means why
uh,
you will not advise me getting
this is because
pregnant during this
yes.
period?
Yes, because this during this time, the beta hCG hormone that we monitor for the cancer, that is the same hormone that gets raised once you get pregnant. So then the monitoring becomes difficult, and hence we don't advise women to get pregnant during this time. So and in addition, we would advise you to use some contraception, and that too we advise to avoid the copper coils or the Mirena coils, because these coils can cause perforation in the very soft uterus. And you can use any form of contraception. We would referring you to the contraceptive clinic, and uh, uh, we will be asked to register to the GTD center as we told. So regarding the follow up, do you have any questions like how to follow up?
No, doctor. That's it.
Okay, so uh, I'll be documenting our consultation and sharing you some support links. And the GTD center also has the specialist healthcare professionals who are always available to support you, and even the online support groups are available. Uh, okay, I can know that I understand this must be a frightening experience, but we are always here to help you. And if you have any queries, you can always ask. Any other questions you want to ask?
No, doctor. Thank you.
Okay, thank you for talking to me.
Okay, your own reflection. Your own reflection.
Yeah, sorry, I muted myself. Uh, yeah, I mostly covered in the family history. I had thought that I should not ask, but even then, in the flow of history, I asked about the family history and about the clinical knowledge. Mm, I could have answered before you have asked the questions, but I
No,
think
it's
I was
okay.
able to
It's
answer the
okay.
questions.
No, it's don't be under the assumption that me asking questions mean it is not ideal situation. I am trying
Okay.
to say because you may go hair voice. So it's always better that
Yes.
you will communicate with the patient and you will be on track. What are my concerns?
Yes.
Because
Yes.
you could have
Definitely.
explained me regarding partial molar pregnancy also.
Also, okay. I
Yeah,
thought that
you
is
could.
little bit
Yeah,
out of
yeah.
the topic, so I did not go there. But
Yes, very nice. That's the reason I am giving, means it was a very means precise presentation for what I had come to you and you had guided me accordingly. Okay.
okay.
So that is what part 3 you they are assessing you. Otherwise there are so many things, okay? Because so many things. The only thing is
Yes.
any problem at any time, that safety advice only you need to give her. Any
Mm.
bleeding, any complaints meanwhile, You need to come back, means you need I will be sharing 24 by 7 details. She's at risk of bleeding and all those things, dear.
Yes.
Okay.
Yes.
Yeah. One more question what I was having was, what are the risk of repeat molar
Recurrence.
pregnancies?
Recurrence. Yes, that
Correct.
I forgot. Yes, 1 in 100 is a possibility of recurrence. Means mostly 99 out of the 100 would be a successful. So that is not a very big problem. Should not
Yeah.
be stressed
That is
about
the
that.
only
Yes.
question because you completed the time, so that's the reason I didn't ask you. Otherwise, everything is quite on time, quite completed. Anybody would like to comment on her performance? Anybody? Any fault? Any good thing? Yes, we all know what she has done. Anybody who is able to find out that okay, she has not done this, she has not done that. Anybody? I might have missed also, but anybody can say.
It was very nice
Could have asked
presentation,
for
very
Yeah, very
red flag
nice.
sign,
yeah.
red flag
Yes,
signs we
that
could
safety,
include
yeah,
if
safety
there's
points I
shortness.
said. She can have bleeding,
And
excessive bleeding, any breathlessness or any giddiness. So she needs to report back, sharing 24 hours contact details. That one point she
and,
missed out. Anybody else who
and
can say
early scan
yes?
Was
in the next pregnancy.
how
Yeah,
was the recovery like? She would have asked
yeah,
at the
she
beginning.
didn't ask me. She didn't ask me how was the recovery. She directly went on to
Yes.
the asking. So very nicely she had asked me how I'm coping with the this loss, but then how I am after the
The
procedure.
recovery. Yes.
Yeah, recovery question she didn't ask. Um, Anybody else?
Red flag.
Ma'am, better to use the word sinister changes rather than cancer, ma'am.
No, it's okay, dear. I will not
Okay,
say that. See, yeah, cancer is a common terminology now.
okay.
Cancer is a common terminology. So you can very nicely, rather than that, I had mentioned it, you could have, means, you when I asked from my side, then you said why you, means I asked you why you are worried about doctor, means the treatment has been completed. Then you said no, you will be put on follow because it the abnormal tissue might have been there, and it might have turned into cancer. So rather than saying this, you when you started explaining me molar, when you explained me what type of molar I am having, so it's a complete molar because no fetal tissues are seen. So
Mm.
complete molar. Then we have treated in your case. The molar has been treated in your this abnormal pregnancy has been removed in your case. But why we are worried? It's because sometimes these tissues might come back and it might turn into a more sinister pathology. Sometimes known as GTN, that is cancer. So it's a precancerous condition. So that one thing you would have, means rather than me asking, if you could have elaborated why we are worried about this condition, why we are not taking it lightly, why we are not leaving it like a ectopic pregnancy or abortion, missed abortion. Okay, so that you could have told from your side. That's the reason we need to keep you, and to identify whether these tissues are coming back, we need to put you on a regular follow-up. So those sequences goes from there. Okay, so that is that one thing you could have said. Then uh, planning pregnancy after 6 months, no, totally she will be on follow for 6 months. Okay,
Mm.
even if it is negative for 6 months, but the guideline says she should plan after 1 year. What I remember,
Okay.
what I remember, it has been mentioned that
Uh,
she should avoid conception for at least a year, or at least
it is
parents
only, I just
somewhere
went
ahead.
it.
Okay.
It is 1 year after if she has on chemotherapy. If
Hmm.
not,
Method
then
therapy.
immediately once her follow-up is complete, means within 6 months or maybe sometimes 8 months from the date of evacuation. After that, if there is
She can
no
plan.
further treatment, yes, then she can plan immediately. If on chemotherapy, then
Yeah.
1 year after the chemotherapy.
Completion of chemotherapy. After completion of chemotherapy.
After
Yeah, that is
chemotherapy,
only my
1 year
concern.
after chemotherapy, yes.
Yeah. So 1 year after completion of chemotherapy, it will not be after chemotherapy. 1 year after completion of chemotherapy. Okay, so that is only my concern because I had mentioned 1 year. From where I didn't find it out, I don't know. Blood group you didn't ask because that is one of the important safety information what you need to know. And another question here is draw. So far as draw. Okay.
Draw. Yes, draw.
Yeah, always remember to make understand to a patient, or a lay. Drawing
Yeah.
always keep on.
Like
Okay,
this is a sperm and
I
this
will
is an
show you.
ovum, and
I will
when
show
they
you.
are
I will show you.
okay,
Okay.
okay,
So
okay.
the answer key, ideal answer key, introduction, very nice, situational awareness. Well within time also, huh? Time management was also perfect. You could able to finish your history by 5 minutes. You can cut short it. Okay. You can bring it down to 4 minutes so that your task will be completed. Documenting and writing back to a GP, those are the important points which you had missed out. Okay. Means the GP will be in loop here. Yes or no? GP will be
She
here.
said she will,
Yes.
yes, GP will be
Follow up
included, yes, because she
for
will be
follow
taking the kit to the GP center every weekly for the follow up, maybe urine test or the blood test. The kit
Blood
will
test.
come
Yeah.
to her and then she will take the kit to the GP center.
Yeah. So GP will be documentation, okay? So whatever we had discussed, we'll document. Please ensure that you will document that. Uh, aim and concerns are report discussion. I am anxious. Very nicely you had asked me because I was supposed to follow up with the GP. Okay, I was supposed to follow up with the GP. Now you called me up. I am really concerned. Is there something serious? So my first question is, how are you after the procedure? Any bleeding post procedure? Okay. Signs of molar pregnancy. What I wanted to ask. Although we had evacuated, but we do not know whether there is an ongoing molar pregnancy which is continuing. Okay, so I had asked her nausea, vomiting, pain in tummy, headache, breathing difficulties, fever, bowel bladder complaints, weakness, weight loss, loss of appetite. 2 or 3 questions at least you can ask. I had elaborated very detailed. Okay, because it's my way of elaboration, but at least you should make aware of the examiner that also you are thinking of a possible ongoing means ongoing continuation of this molar pregnancy. So that is symptoms at least two, one or two three. The details whatever has been given to you in the HPR, this was not this paper which was given to me. I just tried to give you idea. The exam in the RCOG exam they will definitely give it to you like this only. So clinical details they had given, 8 weeks pregnant, diagnosed and had a surgical evacuation. Very nicely you had acknowledged that details, and you means you said that it was surgically evacuated. So acknowledging that details is very important. Now details you asked me, I told you everything whatever was there in the situation. Now menstrual history, when was my last period is very important here. You missed out on that. Hello.
Okay, okay,
Because I should not get pregnant meanwhile. It is 8 week.
okay.
Means we do
Since
not know na.
since
Yeah.
the
So
yes,
yeah, since how long, and it should not get. So when was your last period? Have you resumed sex? Any contraception you are using? Huh? If she is using copper coil or something like that, at least resume sex. They are very keen of resuming sex. So
yeah,
always ask, use effective contraception. Mental history per se, she is actually, I am very easy go. You in the beginning only you ask how am I coping, so that will I'll always include it. Okay, so I will not say that mental history. Otherwise fit and well, allergy, smoking, blood group, BMI, alcohol, occupation. These are additional information what you can gather if you think. Okay, smoking is very important, allergy is important, blood group, we is it's always better that early pregnancy care you need to know a blood group. Occupation or alcohol you can skip. Okay, and support, do you have adequate support at home, because something is very serious. Okay, so it is partial BBN. Very nicely you had explained me partial BBN. I will not take it as a complete BBN. Okay, it is a partial. What you missed out, Dr. Bhumika, is checking my background knowledge about my report, whether I am aware about report. And once you started explaining me molar, have I heard this terminology?
yes,
You asked me, have I heard this terminology? But whether I am aware about this report is very important point which you should not be missed out. Okay. So my whether I am aware about report, then it will not be BBN. And starting and checking my knowledge about the condition, you checked. I think you checked my knowledge for that, but for the report you didn't check.
yes.
Okay. Then very nicely explain me the report. I'm going. Okay, so this is what I had explained here. Okay, so Just mute yourself. So your report by name, report of lining of the womb. So it's some of the cells of the afterbirth, some pregnancy tissues which are thickened, swollen changes. So I had elaborated here a little bit. Okay. So the means I had just elaborated, but you can directly say that the tissues which are sent for the tissue testing shows a pregnancy tissues which are thickened, swollen, and the changes are pointing towards a molar pregnancy. Have you heard of this condition any time? This is a pregnancy, this is a abnormal form of pregnancy, and uh, if not followed up, if not followed up, then sometime the chances are also there. They have given some 15% chances, no, 10 to 15%. In that
Yes,
case,
15.
it might turn into a uh, cancerous situation or cancerous condition, which is known as GTN. Here you can say this is GTD. Now then if it is if it converted to cancer, then it will be known as GTN. Okay, that is one thing. The report what you had shown was a complete molar pregnancy. You mentioned, but you mentioned complete molar pregnancy, you mentioned. Okay, but you have to mention that this report is showing complete molar pregnancy. That way the sentence should be completed. That is knowledge part. You mentioned me, you explained me about complete molar pregnancy, but then you explained me that this report is a complete molar pregnancy because no fetal tissue, or it the ovary means the ovum, or it was an empty egg which was fertilized by two sperm, so two sets of sperm. So that one word is very important, that the report shows complete molar pregnancy. Gestational tropoplastic, it's a gestational tropoplastic disease. If not treated or if not followed up, then the chances of getting it converted to a more sinister pathology or cancerous pathology called as GTN, that is gestational trophoblastic neoplasia. And that's the reason you need to be followed up. Okay, you need to be followed up regularly. Mm, so now what are and here risk factors, that explanation and risk factor I had written into the next slide. So how we are going to do next, what we are going to do next now, it is, yes, very nicely referral to a GTN center, Dandy, London, Sheffield, whichever will be there, and registration with further follow up of beta HCG, beta HCG in the form of either urine or blood, whatever, and that needs to be done at GP surgery. So now what is molar? So what is normal pregnancy? In normal pregnancy, generally a egg which contains a set of chromosomes fertilized by a sperm which contains another set of chromosomes, and a baby gets formed in normal pregnancy. Okay, so what is something like this I had shown. But in molar pregnancy, here we are just going to talk about complete molar, so we are not going to say about anything about partial molar. But in your case, what had happened, the empty sperm was fertilized by uh, two sets of sperm, or a set of a single sperm which gets duplicated, and there are no maternal genes or no tissue, no set of chromosomes from the mother, and this is a complete molar pregnancy. So I am going to explain here only about complete molar pregnancy. I'm not going to explain here about a partial molar pregnancy because it's going to take our time, and it might not give us a mark also. So what are the risk factor? Yes, very nicely mentioned. We do not know why exactly it is happening, but there are certain association. It is associated with ethnicity. Asians are more prone for molar and extremes of ages. Now what? Now what? We will be offering you baseline blood investigations along with beta SCG and chest X-ray molar registry. Okay, so all this will be a baseline investigation, baseline blood investigations, and the next will be the treatment modality. So now no surgery. Here I am precisely mentioning that we need to follow you up. We are not going to intervene as this point at this point of view time. No medicine, no surgery, only regular follow up. But meanwhile, keep a watch on bleeding. Any concerns, you report to the emergency with 24/7 contact details. Mostly wait and watch with regular follow up with beta HCG levels in blood can be done at TGP surgery. Follow up 6 months post normalization if within 56 days. If the beta HCG get normalized within 56 days, 6 months follow up is sufficient from the date of surgery. If not, then after 56 days, if it is getting normal, then from that to time, so we are going to monitor you for 6 months. Okay, Yes, you very nicely you had reassured me. Most of the time, this condition responds, and we may not need to do any further thing apart from follow up. But in but sometimes it may recur, and if the hormones continue to plateau or increase, then in that case there is a possibility of cancer cells. In that case we will be offering you chemotherapy in accordance with the MDT. Here you can just talk molar MDT, you can put one word in accordance with the molar MDT. Any questions so far? As now regarding my pregnancy, I know you are very anxious to get pregnant, but with this follow-up, since this hormonal follow-up will interfere with pregnancy hormones and we will not able to follow you up properly, it is advisable to avoid pregnancy for at least 12 months from here onward, and use effective contraception. So avoid copper coil. You can use condom, you can use oral contraceptive pills also. They are mentioning oral contraceptive pills. Actually, I didn't get time to go through FSRH. What are the modality of contraception in her case? Copper coil will not be used in her case. Initially, there was a guideline when they used to say that hormones should not be used in molar, but nowadays, what is the newer guideline, newer techniques, newer thing? I feel COC is
We
still
can.
safe.
Yes,
Yeah,
ma'am, they can. That
yeah.
one.
So COC can be used, condom can be used. These are the contraceptive, but avoiding any intrauterine devices. Yes, then this is a overwhelming period, a difficult period. So I will arrange a counselor, and close the loop means whenever I use a sentence close the loop, so something comes up in that sentence, documenting your care, writing back to a GP, give details about Molar's pregnancy support group, and inform the consultant. Now our consultant needs to be informed at this point of time. Okay, so all these important points will be closing the loop. Very nicely done. See, everybody is not perfect, but at least you were very quite on track. You it was looking like a means a consultation rather than a monotonous task. Okay, and you were interacting, you were addressing my concerns. Very well done. Keep it up, dear. Very well done.
Thank
Yeah, so this is Molar Pregnancy Support and Information. Please remember, always take a name of PIL, always take a name of support group, because they expect that. Uh, Established diagnosis. Okay, so this is established diagnosis to the patients in layman's language, and the need for baseline investigation, beta HCG and chest X-ray. Okay, but I had mentioned here everything, including baseline blood investigations also, so that we will able to follow up her. Explain the implication with respect to increased risk of choriocarcinoma or persistent GTT and chemotherapy SOS. Explain the need to register and have a follow-up with one of the three regional centers. Explain the follow-up through a test of urine samples sent in the post-blood test with GP counsel about the diagnosis, and this will be delayed trying for another pregnancy. Describe clearly logical approach, different management option, pros, cons, especially contraception, including complication, rationale for care and follow-up. Summarize discussion about diagnosis, implications, and need to follow-up. It is not possible to summarize because time time management means we are, I don't know how people are summarizing, but even I didn't find it easy to summarize. Check patient's understanding at appropriate intervals. Offer patient information leaflet, liaise with support groups. Specific information leaflet, specific support group. Please remember that. Okay. From here onward, you can start writing the name of the support group and writing the name of the patient information leaflet. Complete history to help understand what was done in information gathering, review records, interpret the histology report very nicely, obtain further history of plan for pregnancy, certain anxieties, address them, comprehensive history about pregnancy, family history of molar pregnancy, and review histology. So, Pam, why I asked you family history, dear, and you got confused? Okay, because
yes.
okay, so
I
here
did not
you
know
are.
there is a family history for Mola. I thought there is no family history. So
No,
I
there are genetic.
have
We do not know, but at least any
genetic
abnormal
causes.
pregnancy, yeah, any abnormal
Yes.
pregnancies. Hmm?
Okay.
Review histology, request appropriate investigation and interpret results, baseline blood investigation, CXR and histology, knowledge of history of future pregnancy plan and contraception, past and future. Okay. Communication with colleague here, GTD will be one. Senior, that consultant you have to bring somewhere here. Okay. You are managing this case till now, till that everything, but at least you are going to involve your consultant once the completion has been completed. So now my consultant will be informed, GP will be in loop, GTD center, support team here, it will be counselor also. Counselor will also be a part of
Okay.
our communication. Patient safety, allergy, prescription, discussion of complication that patient should look out for. Okay, so she will be looked out for any unscheduled vaginal bleeding, symptoms of metastasis, hemoptysis. Okay, future pregnancies, preparing for this. What to do when pregnancy test is positive? Empower the patient to make informed choices on treatment option. Explain the risk of unprotected intercourse and contraceptive options. Empower patient to make a right choice. Certain allergies. Here, there wasn't any allergy. uh, Discuss pathogenesis of molar pregnancy. The recurrence rate after one molar pregnancy increased 10%. That is from 1 in 600 to 1 in 60. Okay. So actually 1%, the new guideline is saying 1%, not 10%. Okay. Discuss the need to prevent pregnancy while SCG levels are being monitored. Provide information on pregnancy after molar pregnancy. Explain why follow-up and why HCG levels plateauing or rising may indicate persistent disease or choriocarcinoma and need for chemotherapy. Demonstrate having up-to-date knowledge of contemporary literature of Green Top guideline of RCOG. So I will give you total clear pass regarding this task. Very nicely done, dear. Very nicely done. I'm happy.
Yeah, thank you.
Anybody is having any question? No?
Ma'am,